The governor says get vaccinated.
Well, I understand that, but I don't know why you need a health order for that. It seems to me like you could just continue on with your promotion of and encouraging people to get vaccinated. But what are under the health orders? I need to...
I don't know either.
Yeah.
I looked at the Opinion Post and I saw that. So I knew that we have health orders, but I don't know what they are.
Yeah. Let's see. Let me tap on this button here. I'm looking on my phone, which has an internet browser. Okay, public health order, New Mexico Department of Health. Okay, so this was in April 15th, and this is what they've extended through May 15th. Following public health amended public health emergency order implementing additional contact tracing information for all labs and submitters submitting notifiable condition COVID-19 test results. Emergency order implementing administration reporting requirements for all vaccine providers. Amended public health emergency order temporarily limiting... Okay, so this is one of the things that was extended, Barking Guy. They have limited visitation at long-term care facilities. Let's see, requiring information to be provided by individuals registering to receive the vaccine. So you still have to tell them that you've been vaccinated. You still have to it has to be reported. You're still in the system. Okay, all school workers comply with certain health requirements requiring congregate care facility workers, hospital workers, and employees of the Office of the Governor be fully vaccinated and receive booster vaccines. So that is still in effect. So if you work for the governor or you work in congregate care facilities, hospitals, you have to be vaccinated and you have to be boosted. And then I'm guessing the school workers, you either are vaccinated or you're tested every day. Whatever the current testing requirements are for non-vaccinated school workers. That's still in effect. So that goes through the middle of May. Whereas, unless the healthcare provider instructs otherwise, all individuals ages 2 years and older shall wear a mask or multi-layer cloth face covering in all public hospitals, profit or nonprofit private hospitals, general hospitals, special hospitals, nursing homes, assisted living facilities, adult daycare, hospice facilities, rehabilitation, state correctional facilities, juvenile justice facilities, residential treatment centers, New Mexico State Veterans Home and community homes, except when eating or drinking. So you still have to wear a mask in all those places. Any business establishment or nonprofit which members of the public regularly visit must report when there is an occurrence of a rapid response. The Environment Department shall monitor when an entity has 4 or more rapid responses within a 14-day period. So that's still in effect. That's been extended through May 15th. Public and private educational institutions serving children and young adults from pre-K through 12, including homeschools, serving children who are not household members, shall continue to adhere to the face covering requirements contained in the Public Education Department's response toolkit for New Mexico's public schools. But there is no mask mandate in the schools. I mean, it's an option now, right?
I believe so.
Yeah, it's an option. So they do have some face covering requirements. Let's see, public and private coverage in person included in the toolkit. It may operate up to maximum capacity. Public and private educational institutions shall follow the reporting, testing, and closure requirements set forth, blah, 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 in the toolkit. Serving children shall continue to adhere to the face covering requirements contained in the Public Education Department's COVID-19 response toolkit for New Mexico's public schools. But I know that it's not mandatory on the masks in the schools. But I think the one thing that really surprised me was the first time they did the mask mandates on the schools, it didn't necessarily apply to the private schools. And so you had some parents that moved their kid out of public school and put them into private school so that they wouldn't have to fall under the mask mandates. Then when the second mask mandate came down, the one that we operated on for most of the year, you heard the language.
Yeah, I did.
Private schools, home schools, if there's kids that aren't from your family that are in your home school and all that kind of stuff. But then you remember they lifted all that earlier as far as mandatory. And you don't see a lot of mask wearing going on in the schools anymore. There are some school districts around the country that are still making kids wear masks.
Yeah.
And it's amazing how that's continuing to be in effect and enforced. And I guess the big question is, Barking Guy, was it the masks that led to us being at this point now where hospitalizations are way down? Or was it we finally got a variant of the COVID-19 virus that most people could handle?
It's probably the latter.
Probably the latter. You know, I don't want to say that masks had no impact at all whatsoever.
I can't say that. I can't say that either.
But I really think it's more as people recovered and gained natural immunity, as people were vaccinated, the virus mutated, as all viruses do, to stay alive, and it mutated into a form that our bodies, most of us, can handle. Not all, obviously, but not all of us can handle bronchitis. Not all of us can handle pneumonia. Not all of us can handle a whole collection of other illnesses that people get sick from and die if they've got compromised health conditions. So are we ever going to acknowledge that COVID is in that category of, for the most part, people get sick and deal with it? Some people have very bad difficulty with it, and it can cause some people who are compromised to be just too much for them to handle. When is it going to move into that category? Or are we going to continue to sit here and get a press release on a Friday before Easter reminding us that we still have health orders in effect?
And this is that same governor who told us not to go to Easter services
2 years ago. That's right.
2 years ago. And also attack St. Nicholas.
That's right.
And Christmas.
That's right. That's right. So it's going to be interesting to see, because there has been some data. There has been some data that's been released that shows states like Texas and Florida, the death rate from COVID was no different than states like New Mexico. And states like Florida and Texas didn't tell people not to go to church on Easter Sunday. It did not have anywhere near the kinds of restrictions that states like New Mexico had. And they, therefore, had less negative impact on their economies than what we had in New Mexico. And their death rate from COVID is no different than New Mexico's death rate. So, and this is really, whether or not anybody remembers this when they go vote this fall, this has got to be one of the reasons why we need to vote, cast a vote in the upcoming general election. Are you in favor of keeping in power somebody who thinks through mandates that they can keep us all safe and healthy, when most of what they said that we had to do had no real impact on the mass population? Or do we want to go and try a different approach and be more like states like Texas and Florida in how we handle things like really, really, really bad flu bugs like the COVID-19 flu?
Yep. And we have an election coming up. We have a primary election coming up. May 10th is the last day to register. before the primary, and you must be a member of one of the three major parties in order to vote in the primary.
Two major parties and the Green.
No.
Or Libertarian.
Libertarians.
Yeah, they're not. I wouldn't call them a major party.
Well, according to New Mexico, they are.
I understand that.
They qualify to be a major party and to have primaries.
I understand.
But as far as them fielding candidates, the Democrats and the Republicans field more candidates than they do.
That's right.
Than the Libertarians do.
That's right.
But you have to be one of those three in order to vote in the primary.
Which I'm fine with that. I think that's how it should be. I don't think Democrats should be picking Republican candidates in the general election. I don't think Republicans should be picking Democrats.
And that's what we had in Michigan.
Mm-hmm.
We had an open primary.
Mm-hmm.
So, of course, there was Operation Chaos. There was crossover votes.
Yeah. Mississippi was like that, too. I don't know what it is now, but when I lived in Mississippi, it was open primary. You walked in, and like in our case, it was in a school. And so you walked in the door, and if you went to this room, you voted in the Democrat primary. And if you went into this room, you voted in the Republican primary, and you made your choice standing in the hallway. It didn't matter what your party affiliation was. You walked in and said, all right, am I going to vote for the Democrats or am I going to vote for the Republicans? And then you walked into whichever room you wanted to walk into and vote. You couldn't walk into both. You had to pick one.
Yeah.
So, no, I prefer the closed primaries like we have in New Mexico. I think that's how it should be. The parties should nominate their candidates.
That's right.
That's my belief. But then again, I'm an old coot. All right, let's take a listen to this. The Barking Guy's here. We've got some results from athletics last week. Don't go away.